Hello friends, welcome back to my YouTube channel once again. So today I'm going to discuss about the one of the most important topic, muscles of mastication, which is the most important question in the first year BDS anatomy, and it is most important to know about this anatomy because it will help you in whole dentistry. Okay, so make sure you are till the video ends, you are staying here and seeing, because I'm going to tell you the most important questions which will be asked in the examinations. Okay, if you see my slides and write this much also, it's more than enough, because I have given the point wise. Okay, not I have not gone into the details like in the slides. I have just given you the brief and to the point which should be mentioned in your answers. Okay, so let's begin the topic, muscles of mastications. Okay, this is how the diagram. Okay, you have to know this diagram, you have to practice this diagram very well. Okay, so what is muscles of mastication? This is a group of muscle derived from first pharyngeal arch. Okay, they are primarily responsible for the movement of mandible during the mastication, such as elevation, depression, protrusion, retraction, and side to side movement. All the muscles of mastication are supplied by mandibular division of trigeminal nerve. Okay, that is V3, which is the nerve supply to the muscles of mastication is the mandibular division of trigeminal nerve. Okay, so there are four pairs of muscle which help you which help for the movement of the mouth. Okay, that is masseter, temporalis, medial pterygoid, lateral pterygoid. Okay, so we'll see one by one. Okay, see, this is where the masseter is. You can see the near the ramus of the mandible. Okay, masseter, temporalis, medial pterygoid, and the lateral pterygoid. Okay, so this diagram also take a screenshot and practice this many times so that you remember each and everything. Okay, so next is we are going to come in, going into the depth of the masseter muscle. Okay, so how the where from where the masseter muscle is originated: superficial head, zygomatic process of maxilla, and the anterior two-third of the zygomatic bone. Mainly it is near the zygomatic process of maxilla and anterior two-third of the zygomatic arch it is getting originated. Deep head, where it will be posterior one-third of the zygomatic arch, where it get inserted lateral surface of the ramus and angle of the mandible, as you seen in the diagram. Okay, so this is how the this one. Okay, origin from the zygomatic arch and the maxillary process of zygomatic bone. Okay, insertion of ramus and coronoid process of the mandible. Okay, this diagram you have to know. Okay, so what is the nerve supply? As I told, mesenteric nerve. Okay, action, elevation of the mandible. Okay, the main action is elevation of the mandible. Okay, though what is clinically significant? Hypertrophy seen in bruxism. Okay, then painful in TMJ joint disorders. Okay, it is most painful in TMJ joint disorders. Okay, so next muscle is temporalis muscle. Okay, so origin is temporal fossa and temporal fascia. Okay, insertion is coronoid process and anterior border of the ramus of the mandible. Okay, nerve supply deep temporal nerve. Okay, next is the diagram. See here the temporal muscle, can you see here? Next is action. What is the action? It is also for elevation of the mandible. Okay, so clinical, what is this? Tenderness seen in the TMJ disorders. There will be tenderness. Okay, when TMJ disorder is there. Okay, so spasm causes limitation of the mouth opening. It will cause the limited mouth opening during the TMJ disorder. Okay, so next muscle is medial pterygoid muscle. Okay, so origin deep head, where it will be medial surface of the lateral pterygoid plate. Okay, superficial head will be maxillary tuberosity. Okay, insertion medial surface of the ramus and the angle of the mandible. Okay, the nerve supply is medial pterygoid nerve. So this is the diagram. Okay, take a screenshot and practice it. Okay, next action, elevation of the mandible, protrusion, side to side movement. Okay, it will help in side to side movement also. So clinical significance, how what will be there, spasm lead to trismus, okay, from restricted mouth opening also you can see, okay. So next is lateral pterygoid muscle, okay, origin superficial head, greater wing or sphenoid, okay. So in inferior head, lateral surface of lateral pterygoid plate. So insertion will be neck of the mandible, articular disc and capsule of the TMJ. Nerve supply, lateral pterygoid nerve, okay. So this is the diagram of lateral pterygoid, okay. So action will be side to side movements, control movement of the TMJ disc, okay. So clinically dysfunction cause TMJ clicking sound you can hear. Important in the mouth opening, it is very important to opening of the mouth, okay. So action of each muscle we'll see. For elevation, which are the muscles are masseter, temporalis, medial pterygoid. For depression, lateral pterygoid, okay. For protrusion, lateral pterygoid and medial pterygoid. For retraction, temporalis. Side to side movement, medial and lateral pterygoid. So development, as I said, you derive from the first pharyngeal arch, okay. Blood supply will be branches of maxillary artery. So conclusion, what will be the, it is the these muscles are mainly for mastication, chewing, speech, mandibular movement, okay. Are the most important function of these muscles. So this is how the muscles work, this all things. So exam tips are, draw the neat diagram as possible, okay. Practice it, mention origin, insertion, nerve supply and action, okay, clearly. Write about the clinical for clinical importance for extra marks. This is all about the muscles of mastication. This is the one of the most important question of for 10 mark. They can ask 5 mark also, like they'll be giving an individual muscle like masseter muscle, temporalis, lateral pterygoid, medial pterygoid. If you write this much and draw the diagram, it's more than enough, okay. I hope you like the video. Do like, share and subscribe my channel. Thank you. And yeah, one more important thing, practice the diagram as much as possible, because diagrams are self-explanatory for the exam point of view, okay. The whatever I have given in the slide, just if you write that much points are more than enough for your exam. And to understand also, when you are reading this, keep the diagram next to you so that you can see and read the answer properly. So this is all about the muscles of mastication. Thank you for watching. Do like, share and subscribe my channel. Thank you. We'll be coming with new videos. Thank you.